and learned how to cry like humans do.
Welcome to the Tommy Rocket Show. I'm Peter Phipps, journalism professor at URI, a retired journal editor, longtime journal editor. And with me today is Dr. Timothy Rivinus. Timmy and I have both been on the show before, but this time he's going to really play to his strength, and that is issues of the mind which affect the body. Dr. Rivinus has been a practicing psychiatrist for 50 years, faculty appointments at Brown, Harvard, BU. And today's show, where I'm not just going to ask questions, Dr. Rivinus is going to lead us in exercises. So get ready to relax here. This show is on stress, and we hope you learn some things about how to deal with your stress.
So we're just talking about that you can't really tell somebody else to relax or stop stressing. That's an issue for yourself to take care of, including managing your environment and also managing your internal milieu, your own homeostasis, balance.
But, you tell your friend, why don't you just relax? Cut it out, will you? You're stressed out. You're bothering me. Doesn't do anybody any good.
And I can tell you that makes me more stressed when I even hear it from you. And there'd be no doubt that you do a show like this and you do them intermittently, you're going to feel stressed and feel anxiety.
Right.
But you need a certain amount of that to rise to the occasion.
Right.
Don't you feel?
I mean, we talked about this before. I was in the news business for a long time. We all joked we were adrenaline addicts, and we really got off on it. And something happens, news breaks out, most people would go into a sweat. We jumped into action, and it was exciting. You didn't know what time it was. The clock, all that existential business about time and who you are and you're inside and you're outside, completely disappeared, and you're totally into it.
Yeah.
What got me nervous, as both an editor and a reporter, is what you didn't have anything, and time was running out.
Yeah.
And then
the downtime.
Yes, that was the hard part.
Let me show you Exhibit A here. I want to make sure that you can all see this. This is a thing called the inverted U curve.
Right.
And performance is on the vertical, and anxiety or stress is on the horizontal at the bottom. Now, if you have, you can perfectly clear that if you look at the bottom here and you have no anxiety or stress, your performance is going to be nil.
Flat. You're going to be flat. Yeah.
So you have to generate a certain amount of anxiety to do your maximal job. So at the top of the curve is, of course, your maximal, and that's where you shoot to be. But if you overshoot and you're too stressed, and this is the point, how do we manage our own stress and how do we manage the stress of the world we live in? We want to manage ourselves as close to the top of this curve as we can without being absolutely without any energy or with too much energy so that we burn.
I think we can all relate to that. And so you know when you're hitting it, and you know when you've lost it, when you're too far down the anxiety line. But how do you talked about something called a body scan. How do you're on your own, you got to deal with it. How do you go about getting yourself calm?
I thought a couple of things that might be helpful to the audience and to ourselves even would be to do two exercises, one at the beginning and one at the end of our presentation, to just let people know what the techniques are of helping one deal with one's own stress and how to get focused on oneself and slow things down externally and internally for oneself to be able to manage stress better. Now, of course, being in a quiet room, like the room we're in now, is very useful. So finding a safe space to be in is the first way to start. And then one very useful exercise to do would be to learn how to relax the body, because when you relax the body, the mind will also follow. And the internal organs will also follow. The mind, of course, we think of in several parts: the thinking part of the mind, the feeling part of the mind, and the autonomic part of the mind that governs heart rate and blood pressure and internal sensations of heat and pain, things of that sort. And so how do we get more command over all of those? The following I want to suggest to you would be to take a moment, close your eyes, take a deep breath, and follow it with another deep breath, beginning at the diaphragm and letting it rise up through the chest. Take one more breath, slowly and at your own pace. Now imagine where your feet are placed on the ground. Think about the placement of your feet and the sensation of your feet while on the ground. Get a sense of your ankles. Get a sense of your calves and shins. Place them in space. Connect them with your body. Now your knees, your thighs. Those are all bones and muscle, ligaments and joints. In muscle, we carry a lot of tension. In our joints, we carry the flexibility to be able to move in space. As we get older, our joints begin to suffer, our bones begin to suffer from something called arthritis. And arthritis can be worsened by a lot of stress. If the muscles don't relax and the body is in constant tension, it lowers the immune system, and that's where illnesses such as fibromyalgia will come up. Now take another deep breath. And imagine your belly, your abdomen. Let it breathe in and out. They call abdominal breathing. Consider what's inside the abdomen. Keep it simple. Just think of the intestines and the whole digestive system alone. That's part of the system that provides us nutrition and is our first step in metabolism. If we're able to keep our intestines and our digestive system more or less relaxed, or as relaxed as we can, we're going to digest better. We're going to have smoother rhythms. We're less likely to get various stress-related diseases, because stress on the internal organs of the intestine can actually lead to disease. And we know now that stress is related to illnesses like ulcerative colitis, Crohn's disease, irritable bowel syndrome. Now take your thoughts to the chest. It rises and falls as we breathe. Take your thoughts to what's inside the chest, the lungs. They are our contact position with the outer world. Taking oxygen in and breathing carbon dioxide out. This is life-giving. If we breathe slowly and evenly, we can calm our bodies. If we're out of breath, particularly sitting, and we feel out of breath or short of breath, we know we're out of balance. Of course, when we're exercising hard, we need to increase the lung capacity, exchange of oxygen, to feed our muscles and our brain. Take your attention now to the muscles of your hands, your arms, your shoulders. Try this very brief exercise. Clench your fists very, very hard as you can, and let them go. And feel a sensation of calm come into your hands. Now proceed to your throat. When you can speak evenly, as Peter and I are trying to do, we help people relax outside of ourselves, and we relaxed ourselves. Take your attention to the facial muscles. If we're tense, we tense our muscles, we grimace. We're more likely to get wrinkles over the years. We have an aspect to us, if we're tense in our face, that alarms other people and affects others. So our ability to relax our face as we think about it is a communication, both inward and outward. That's a brief body scan. You could do more parts of the body and think about them as specific, and Peter and I will do that together when we talk about the stress and the various parts of the body in more detail. Now open your eyes. Take another deep breath. And let's continue.
Well, we should be very relaxed now, right?
I feel it.
I
How
do.
about you?
I do. So we know we have something, a tool, I suppose, right? What are the triggers to watch out for? I mean, we should be able to tell when we're stressed, and we should be able to understand with a sense of ourselves what are our triggers. So what are common triggers for stress?
I think that's good it's good for everybody to ask oneself what triggers them. Is it loud noises? Is it, say, flashbacks of people who've been traumatized? Is it fears, say, of global warming and climate change that pervade us? Are we dealing with memories that are intolerable in some way? Are we stressed by the people we're with? And so it's important.
We have about a minute to go for the first segment. We spent the whole time with our eyes closed. It was quite nice. But one thing I know I wanted to talk a little bit about sometime during the show is that your work with veterans, which
Sure.
is acute stress. You were a Vietnam veteran and you worked for 16 years at the VA.
Yeah.
We'll talk after the break about that if we could, because sometimes if you get a sense of, wow, that's really stress. Why am I worrying about I can't find my wallet? Or why am I worrying that I have different color socks on, or some things that we worry about. But let's talk about what it's like to be at war and to come home from war and sort of the acute issues that you dealt with after the break. How's that? We'll be right back after these messages.
Behind the beauty lies the beast. Please buy cruelty-free. For more information.
We're back. I'm Peter Phipps. This is Dr. Timothy Rivinus. We're talking about stress, and before the break, we talked about acute stress. And you have direct experience with soldiers damaged by war, trying to re-enter society and deal with their memories and their experience, and the trauma of acute stress. So how does that go? Is there any answer? Can you help them? How do you help them?
Well, I could certainly speak to that. Certainly the primary answer would be prevention. If we could stop wars, we wouldn't have combat-related post-traumatic stress disorder.
Well, I'm a conscientious objector myself. I should tell you I endorse that.
Well, it's a good thing to endorse, and yet humankind doesn't buy that universally, and I'm afraid we're stuck with wars as the efforts to make a solution to political problems when diplomacy fails. And that is Clausewitz's famous statement, and we're stuck with wars in many ways, and in this country we certainly participated in our share of wars since the war that was supposed to end wars, the First World War, and then the Second World War. The hope was to pacify Europe, develop NATO,
Right,
European
Marshall
alliance.
Plan, et cetera, right.
So, but we've been involved in more wars than we can count. I spent 7 months in war zone myself, the beginning of a war zone, and I worked for 16 years with veterans with combat-related injuries,
So what
psychological injuries. and
So what are
physical.
those psychological injuries like? We've all, during World War I, it was shell shock, it was called. It's no different than what you were dealing with, is it?
It's the same thing. In fact, you can go back to seminal writings, go back as far as Homer, and read many of the symptoms of post-traumatic stress disorder, which is what it's called now. And a lot of the symptoms have to do with, first you have to be exposed to the stressor or a number of stressors. Either you experience them yourself or you witness them in other people. In war, it's usually both. Then there are a group of symptoms that have to do with mood, and mood usually relates to symptoms of depression, anxiety, fear, sleeplessness. We were just talking about sleep in our break just recently, and I'm going to mention a book with a number of resources for people who are having various kinds of symptoms. External triggers, of course, is a big factor for people with post-traumatic stress disorder. A question is, why doesn't everybody get post-traumatic stress disorder?
Everyone who's been in the battlefield, why don't they exhibit the same sort of problems?
Most
They seem
do.
natural to me. Seeing people blown up and things destroyed, and someone die next to you, etc.
The truth is most do. And the reason it's called post-traumatic stress disorder is that many people don't experience the symptoms right away. They'll come back to a family, work hard, immerse themselves in work, have a good marriage that's supportive to them, or they may retreat into escape from their symptoms by alcoholism or substance abuse, or by thrill seeking, overworking, which is a stressor unto itself. And many men and women who come in for treatment for post-traumatic stress disorder come in when they stop work, when they retire, or when they lose their spouse, and they're alone. And that's when the
Those are
symptoms
triggers for
come.
them.
The
Right.
flashbacks, the dreams,
Right.
the depression, the various bodily disturbances, and the reaction to things around them, such as firecrackers or fireworks on the 4th of July.
Yeah, I've seen
Loud
that with a
noises
friend,
and-
going to a movie, and all of a sudden there's a loud noise in the movie, and he had to leave the movie theater.
Yep. Many men and women flee a movie theater for when there's any combat going on. It's remarkable that anybody can tolerate the amount of.
So what can you? How do you help?
How do you help?
What do you do?
Well, first, I think you have to understanding what the problem is. And then I think the other thing is, once you and the people who work with you and work with veterans with stress disorders have to be able to communicate their understanding of what the problem is to the patient or to the group of patients. One of the remarkable things that happened after the Vietnam War is that post-traumatic stress disorder really got its formal definition, no longer called shell shock or nervous disorders of war, the kind of nomenclature that was used back when nobody took the time to figure out what this was all about, despite the fact that there was literature on it. Vietnam veterans and the psychiatrists who worked with them really put the criteria for post-traumatic stress disorder on the map. And I want to point out one of the authors who's very helpful in talking about post-traumatic stress in veterans, and then the epidemic of stress the culture suffers, is Bessel van der Kolk. And this is a terrific book with a great title called The Body Keeps the Score. And it's a great title because our bodies talk to us, and we talk to our bodies in return, and it's that conversation that helps us deal with stress. So a lot of the
which
treatments...
was something like our introductory exercise.
Exactly, exactly. Or many, many other approaches, some more tailored to some than others.
Right.
There's this book is also useful because in the back it's got a lot of useful resources. We are talking about sleep disorders in the intermission, and there's an app for veterans with sleep disorders that's good for all of us if we have sleep problems. There are apps to deal with post-traumatic stress disorder. The Veterans Administration's done seminal work on this. And of course, at least half to 2/3 of the work done in the VA is with combat-related psychological wounds or physical wounds.
You know, but the title is a transition to, I suppose, the kind of stress that many deal with who haven't been at war.
Right.
And that's called chronic stress, right?
Well, there's acute stress and chronic stress.
Right.
It's important to differentiate between the two.
The military trauma, seeing your buddy blown up next to you, that's certainly acute. Car accidents, any kind of severe violent episode in your life. But what's chronic stress? What does that mean?
Well, chronic stress means that you may have experienced stressors in the past, many of them, and they become internalized. So, for example, the combat veteran who has to sit in a restaurant with his back to the wall for fear of being assaulted, that's chronic stress right there. This is a veteran who is on the constant alert. And that also goes for anybody who's gone through prolonged trauma in their lives is going to internalize that trauma and suffer prolonged stress.
Now, we were talking about triggers earlier, and many of us have suffered this in our lives. Problems in a marriage, one form of financial anxiety, poverty being the extreme case, domestic violence in the household, a horrible commute that just ruined your life or something. There's any number of them. A bad boss, a work environment that's toxic. So
that's a great list, Peter.
we can go on. We can go on, right?
Yeah.
So that could result in chronic stress. So that means every day your body is putting yourself through this chemical change. So we might have talked about this earlier, but it seems right now. So what is the biology, the chemistry of stress that it's really not healthy for you when you're on the downside of that what's going on?
What's going on? Yeah, what happens with chronic stress, or with any stress, let's go back to acute stress, is that we release catecholamines like epinephrine, adrenaline, and we also at the same time we excrete within our bloodstream glucocorticoids. Glucocorticoids are related to to prednisone or cortisone, things of that sort. And when they're released constantly, we're both stimulated and we have a substance, the glucocorticoids, that will block certain functions in our body because we need to be able to mobilize ourselves for the fight. But when they're released constantly, our body doesn't respond. It gets overused to the impact of the stimulant and the immunosuppressant effects of the corticosteroids.
Now this is called fight or flight, correct? That switch the body has to turn on for action.
Exactly.
You can see how it evolved.
Yeah.
When the lion's coming at you, if you don't react,
Yep.
your dinner you're not going to reproduce, and so there's an evolutionary pressure for that, right?
Yes, there sure is.
But if it's on all the time, it's going to kill us. Is that
That's
right?
right.
Yeah. And I think, and a number of lists we can have here, but I think there are all kinds of diseases that we can talk about after the break
We will.
that are involved with, you talked about compromised immune system, changes in metabolism, diabetes is a big one.
Big one.
Which is, so there's a public health interest in people, as we said earlier, just relaxing, right?
We are dying of psychological disorders related to stress in ways that our ancestors died of diseases, infectious diseases, accidents, things that are no longer put such pressure on us.
Right, so you can go to the hospital and get your heart valve fixed or something.
Yep.
But if your adrenaline system is running overboard and you're poisoning your body and turning off some other, you're
Driving up your own blood pressure, for example.
right, right. Okay. Well, after the break, we'll get back in the third segment. See you then.
Hi, I'm Pamela Anderson Lee with PETA. You might not think about it every time you get dressed, but every time you put on a pair of shoes, a belt, or a pair of gloves, chances are you're wearing leather. And out of all the things that animals are abused for, leather is the most common. To learn how you can help, call PETA. Thank you.
Welcome back to the third segment of the Tommy Rocket Show. We're talking about stress with Dr. Timothy Rivinus. I'm Peter Phipps. After the second section, we were talking about disease that are maybe not cause and effect directly, but certainly it can be attributed to stress and what stress does to the body and the immune system. And so we left off talking about diabetes, a big one, big problem in America.
It is a big problem, and it's certainly one for us all to pay attention to. Number one, we're living longer now. Number two, we all know about how our nutrition has changed because of processed foods and because of additives, usually fructose, extra sugar. So we're all having to deal, unless we pay very special attention to nutrition. Young people don't pay a lot of attention to nutrition unless we help them. And as my wife points out, poor people can't buy good food. So there's a big issue here that we're exposed to nutrition that is not good for us and is going to stimulate diabetes. Now, what causes diabetes is there are two types. One is you can be born with type 1 diabetes, in which your pancreas fails to produce insulin, either at birth or at some time, usually in childhood.
But that's relatively rare.
It's relatively rare. It used to be the only kind of diabetes. Now, in the last 50 years, it's come to everybody's attention that there's a thing called type 2 diabetes. And type 2 diabetes is an epidemic.
Yes.
1/3 of our American population has type 2 diabetes over the age of 40. And a lot of that, as I mentioned, has to do with nutrition, being overweight, being too sedentary. We can get to the point about overeating as a way of dealing with stress, and the sedentary situation as a lack of ability to use a stress reliever like exercise. Not everybody can use that for various reasons. But many people can, and in this car culture, culture where we used to have things delivered to our door and we don't go to the store to get them anymore, we're more sedentary. Television has helped that. But let me get to the reason why stress is so important. The longer we live and the more stress we encounter in life, the more we are prone to having acute stress turn into chronic stress. There's a wonderful book that I'll also recommend to the audience, and that is a book by Robert Sapolsky called, it's an easy title to remember, Why Zebras Don't Get Ulcers.
And why don't they?
And the reason a zebra does not get an ulcer, talking about an erosion of the stomach wall.
Stress-related.
Which is definitely stress-related, is that their responses to stress are always acute responses. They move in a herd, but a lion might attack them. They either escape, fight, or they don't escape, or they die.
Right.
Yeah.
And they have no cognitive worry loop going on, right?
Nothing of the sort. But we have a big cortex and a big thinking system, and as we were talking about combat, a lot of stored memories of whatever might be traumatic for us, things in the present, the fights with the spouse, our war experience, trauma experience during childhood, fears, political fears, fears of being poor and how you're going to exist from day to day.
Right.
So we store that kind of stress in a chronic way that then depletes us of our ability to respond to our need to produce insulin. Because if we are constantly producing glucocorticoids and the stimulants that get the body to release sugar so that we can do the fight and flight, so that we can mobilize our brains to think of what next?
Right.
How do we get away from this?
Right.
If we're constantly bombarding our system, then the cells in the body, particularly the fat cells, become insulin resistant. And they store more and more sugar in the form of fat.
And then the other thing that happens is there's the comfort food problem.
Right.
And that's partially resulted, I suppose, because it's cheaper to eat at McDonald's than it is to get to Whole Foods, which you can't afford. But the other thing is that there is some comfort in eating fat and sugar, right?
There
surely and why is that?
Yeah. Well, we, from our own experience, will gravitate towards it if we're allowed. You know, and animals can be made to have type 2 diabetes if they're fed the sugar. We've got a natural affinity for the taste of sugar, and refined sugar has exposed human culture to a rapid delivery system of sugar. And fructose, which is the form of most of the sugars and additives, is the most easily
But what's comforting about fatty, sugary food?
Sugary foods, yeah. Well, there are neurotransmitters that are stimulated by sugar. Yeah.
Now, so that's one. But diabetes seems to have two. It's the overeating, the obesity, and then the fact that our immune system has made these fat cells immune to the insulin.
That's right. That's exactly right.
That's particularly complicated.
That is very complicated.
And the other one that you hear about sometime is immune system. How does stress compromise the immune system?
Well, in the same way, the overload of, and the chronic overload of the glucocorticoid system and the stimulant system, that causes us to mobilize for fight flight. The glucocorticoids release the sugar from cells where sugar is stored, and the catecholamines, the stimulants in us, the epinephrine, adrenaline, is what tenses our muscles and makes us ready to think and fight.
Right.
And if we're performing those operations over and over again, we can suppress our immune system in such a way that we can't respond to diseases as effectively.
So you could say, it's inaccurate to say that, for example, stress causes cancer, but if stress inhibits the full vigorous operation of the immune system, well then one could say it's a secondary cause.
It is.
So this is bad business. Everyone should sort of be aware of this. It's not a joke. You know, in the 50s, everyone talked about their ulcer, right? I mean, there was a joke on TV and sitcoms. Everyone joked about their ulcer.
Yeah.
That was the only way stress came up in the 50s and the 60s on television. Now everybody's burnt out and stressed out, and people are writing about it all the time. There is so much consciousness on stress. We talked about this earlier. I went in and said, how do I deal with my stress into Google? How do I deal with stress into Google? And I told you I got 321 million responses in 0.7 seconds. You know, Google brags about themselves. Well, there's lots of material out there, which indicates we're into this stuff, you know?
We are.
And what are we, left to our own devices, what are we doing? You know, like what are we, you don't go to the psychiatrist right away, right? You don't go to the doctor right away. You don't acknowledge you have a problem you can't take care of.
It's
So
often too late.
what do we do? I mean, what do we do is, like, what are those people going on, what's all that stuff on Google for, you know? So what do we do ourselves? Like, what is that self-remedies that you run into in your profession?
Good point. Well, I don't know, I didn't review the several hundred thousand million.
No, million, 300 million, yeah.
300 million.
What to do?
Yeah,
Yeah.
well, what to do's. Some of them are going to be repetitive, of course, of
obviously.
other techniques. Some of them are going to be snake oil. You're like simply trying to sell you some potion that's going to help you relax. And beware of people who are going to sell you, including registered physicians or psychiatrists, who will try to give you a medicine to reduce anxiety alone. There is no magic bullet for anxiety and stress, except to relieve the stress externally and internally. And so many of the things that we found helpful, and there's more and more research on it, are things like meditation, yoga. We did a meditation, a body scan earlier, dance, exercise of all kinds, good relationships, being with good people, thinking good thoughts. If we're able to generate situations where we're a positive frame of mind.
One thing that comes up all the time is goofing around, laughter.
Yeah.
Now, how does laughter, why is laughter therapeutic in this kind of case?
Well, laughter is a wonderful thing to be addicted to, let's put it that way. Because it releases dopamine. And dopamine is what's released in a lot of things that could be very negative addictions. Gambling, cocaine use, things of that sort, driving at high speeds, taking chances of all kinds. But if you can find things like laughter that release dopamine, exercise, running. You were a marathoner and I was a marathoner.
So were you. Right, and I found myself, and I have a daughter, this is today, she has to run.
Yeah.
She can't function without running.
Now,
that's not always good for her
high.
knees and her, yes.
Yeah.
And it would come on only after 45 minutes or so. So, like I never, when I ran a lot, I don't run as much as I used to. I never felt depressed or anxious after coming back from a long run.
Yeah.
You felt great.
Yeah.
So that's the dopamine thing.
It is, and I certainly got that runner's high, they call it, from running. But then you've got to look out for the damage that can be caused. I badly injured my back by insisting on running more than I should have.
Right.
And I neglected relationships at the same time. I was going through
I volunteer a confession here. Yeah, me too.
Confessions both ways here.
Yeah.
Yeah, and men go through a crisis at age 40 and they think they're going to be the new centurions again. Not so fast, man.
Right, right. Well, okay, so these and what we're going to get, let's talk alcohol after. Isn't the number one managed remedy for stress alcohol? Wouldn't you say that?
I would say probably tobacco along with
nicotine.
alcohol.
Yeah, right.
Yeah, I do. But look at the sad epidemic of opioid deaths we have now.
So after the break, we're going to talk about, well, physicians, what physicians do with medicine and medication, and also alcohol. After the break.
Hi, I'm Alicia Silverstone with PETA. When it comes to animals, there's no need to be a classroom cut-up. Use your right to refuse to dissect frogs, cats, pigs, even worms. Contact me at PETA for information on exciting, humane alternatives to dissection. They'll help you make the grade without using animals. Remember, biology is the study of life, not death. Thanks.
Hello, we're back. Fourth and final segment of the Tommy Rocket Show. We're talking about stress with Dr. Timothy Rivinus, and we left off the third segment with the number one stress reliever in America, in the world maybe, alcohol and nicotine. It's a deadly combo. What's what do you think? What's going on with alcohol? How does it work? Why is it the self-medication drug of choice here?
Well, alcohol, first of all, you don't need a prescription for alcohol.
No, and it's fun, I should say myself.
You need to be of a certain age to buy it, but then people who buy it can pass it on to youth.
Right.
And so a lot of young people, particularly those who become chronically affected by alcohol with problem drinking or even addiction, started way, way before the age of 18 or 21.
Certainly.
But it is a natural relaxant. We have a group of receptors in our body that help us relax. One system is the endorphin system, and alcohol, that's the endorphin system is the system which responds particularly to the morphine and morphine-related drugs. They call them the opioids these days.
Right.
So alcohol acts as well on those receptors, and it also acts on another group of receptors called the gabapentin receptors, or benzodiazepine receptors, and they are relaxants. That's where medicines like Valium and Librium and many Xanax and Ativan, many of the groups of drugs that have been problematic for people in the past but are also very useful in acute situations, they work on those same systems. And so alcohol is a over-the-counter medicine that will help people relax. And you and I always hear, well, wait till 5 o'clock, out of work, we're going to have a drink, we're going to relax. Girls' night out, guys, let's go have a beer, that sort of thing. But then alcohol, there are limits to the amount of alcohol that people can tolerate. Some people can't tolerate at all any alcohol.
But for your long-term health, if you're chronically stressed out,
Yeah.
and your answer to that is to have 4 or 5 drinks a day or something, like, is that okay, or?
That's self-medication. You're in trouble then.
Right.
You're in trouble. You're
And
using it for medicinal purposes, and you are partly on the road to trouble with that drug.
right, and where does that road take you? How does that progress?
Oh, it progresses then from self-medication, self-treatment, to the treatment of the need for alcoholism. There's
yes.
a famous statement that says, the person takes a drink, the drink takes the person, and then the drink takes the drink.
However, pills, opioids, we just saw a statistic, 370 million doses in 5 or 6 years in America.
Extraordinary.
And prior to that, Mother's Little Helper, and our culture for the last 40 years has been prescribed anti-anxiety, anti-pain drugs. They're an epidemic, no? Opioid deaths are an epidemic. And people have to go to psychiatrists for those drugs. What's your profession up to?
Well, we live in a so-called capitalist society, I would say more money-driven society, and there the profit motive drives a lot of what goes on here. So sadly, the companies that were making the opiates, Purdue in particular, began to market the opioids in such a way that doctors began to be convinced that pain was something that needed to be treated by opioids. And the medical profession was not ready to fight back on this. The addiction experts in the 1990s warned people about the coming epidemic, but the the commercial aspects of things just took over.
Well, they may have even falsified the fact that it was non-addictive.
That's correct.
One very
That's
thin
correct.
study, correct?
That's correct. And they also, there was pretty good propaganda. They would send out drug reps who would say, look, pain is a specific thing that you need to ask about, and if people had a pain index of 7 or above, they might need some pain medications. And then we know the available pain medications are few. They're liniments that you can put on your on yourself topically, and there's the non-steroidal anti-inflammatories. There are steroids, which you can't take for too long without paying a big price, and certainly the opioids you can't take long without getting addicted to them.
So there's the stress of having pain in your life. The
Yeah.
opioids would deal with that. But then there's just this being stressed, and that would be the anti-anxiety drugs, which
Yes.
were also prescribed in huge numbers. And what role, what responsibility do physicians play? Or is it the fact that your patient's coming in, they're going to go to someplace else, they're bugging you, they're harassing you, I need Prozac, I'm going crazy, I can't, blah, blah, blah. What's it like on the other side of a patient coming in? And
Well, you're asking a lot of questions here, and they're all good ones. Let's segue by focusing a little bit, the remainder on the opioids. They are great stress relievers, the opioids. And many people who have been or suffer from trauma or anxiety find themselves getting tremendous relief from the opioids. The benzodiazepines, in the same way, we have our own receptors for the benzo.
that's the Prozac, for example?
Benzodiazepines are the Valiums,
Oh, the
the
Valiums.
Libriums,
I
the
see.
Xanaxes,
Xanax,
the
yeah.
Ativans, that group of medications. And some sleeping pills as well. People can get addicted to sleeping pills. And they're a benzodiazepine group themselves. There used to be even worse anti-anxiety medicines like the barbiturates, phenobarbital being one of them, that were used, and the addiction to those was very severe. So it was the benzodiazepines, the Valiums, the Xanaxes were considered a wonder drug because they did not get you into the addiction problems right away that the older barbiturates did. So that was a big marketing thing, and there was even a Dr. Bourne who was part of the Pentagon, a head physician of the Pentagon, who recommended using Valium, one of those anti-anxiety medicines,
For soldiers.
For soldiers
Why?
coming out of Vietnam,
Coming out or while they're in Vietnam?
while both in and coming out of Vietnam. So they're showing symptoms of PTSD or symptoms of stress, give them some Valium, send them back into combat. Or if
Fix
they've
them
done-
up, send them back
Fix
out.
them up, send back. Or if they've done their 13 months tour of duty, give them some Valium and send them on their way back to the States.
Of course, the famous example of World War I with the Sassoon and Owens, and they had shell shock, these English poets
Yep.
who went into World War I or in the trenches. They sent them up to Scotland or something, right?
Yep.
And the psychiatrist's job was to get them back together so they could go back to the trenches and die.
Exactly. Yeah,
So the Valium reminds me of that.
Yeah, there's a wonderful trilogy of novels by Pat Barker that talk all
Right.
about that.
The nurse,
Yeah.
right? Yeah, those are good. So what you're advocating, I'm sort of making fun of the others who just overprescribe.
Yeah.
It's a serious matter, but obviously we're talking about things that do work,
Yeah.
and those are like that exercise we had at the beginning, yoga and diet and exercise.
Sure. Before we dive into this, let's quickly cover tobacco,
Right.
Which is a great stress reliever.
Nicotine is?
Oh yeah, nicotine. Well, look at people on a smoke break. There's your perfect example. I need a smoke break, or
Or that's a stress
just-
break, in other words.
yeah.
But what does the nicotine do? It constricts the blood vessels? What else does it do?
No, it allows certain neurotransmitters to relax in the nervous system. There are the competing neurotransmitters in the system, nicotine and muscarine. And nicotine, if you stimulate that muscular system with nicotine, the muscles can relax. However, if the muscles If the muscles are relaxed, nicotine can tense the muscles again. So somebody will say, well, I got to get back to writing. You're a journalist, I got to have a cigarette. And you'll see them smoking all night as a way of keeping themselves supercharged with a stimulant. So,
so at first it both relaxes and then jacks you up.
Yeah, and just one quick note about medicines like Prozac, and there are many others. They can be overused, and they are overused, and that's why it's really important to have a proper diagnosis. When somebody's deeply depressed, the Prozac, the serotonin reuptake inhibitor group can be really essential in helping people pull out of clinical depressions.
Right. So I don't mean.
But
right.
it
There's
shouldn't
no.
be handed
it's
out
as
like
if there's not any reason to take fentanyl, for example, if you're getting an operation in the hospital.
Right.
So, right. Got it.
Yeah.
But let's get back to where we began. Let's end with an exercise. We can all do it, and the show will end on a calming note as it began. All right?
Good, let's do that.
Right.
Well, let's start as we started before. Close our eyes. Think of those muscle groups and the body areas that we learned to relax in the first exercise. Now, it's important to point out that exercises like this need to be repeated over and over again because we become what we do, and we can change ourselves. There's a lot of good evidence about neuroplasticity of the nervous system, and we can change our nervous systems and prepare ourselves for stress because we're living in a catastrophic world, and we need to be prepared internally and with the people we love and work with and our friends and anybody we encounter. We have to be prepared to greet them with compassion and kindness. The three important things then are intention and kindness, and then the ability to keep practicing what we're doing. So let's briefly practice again. Close our eyes, think of those muscle groups that we relaxed and those body parts that we've talked about through this entire discussion and the various diseases involved. And think if we continue to do practices like this and related things like yoga, exercise, good eating, avoiding substances that are addicting, that are not good for us, being with good people, we can prepare ourselves for catastrophe. But here's one of them, is to take time out every day, think about your body, think about your soul, quiet your mind. Breathing is a great way to quiet the mind, getting that gentle, steady rhythm going. And it will help the mind to calm down if you focus on the breathing. Now, our minds wander. The Buddhists call it the monkey mind. It's jumping all around. 50% of the time of our day, waking day, is the monkey mind, is jumping around. But we can slow that amount of jumping around and distraction by focusing on the breath. So deep breath in, deep breath out. Feel that same relaxation through the body that we felt before. Breath in, breath out. Take the troubles of the world and breathe them out. Breathe kindness and compassion and good intentions in. Then breathe the good intentions back out again onto the world. Now we can open our eyes and we're prepared for more of the stress-filled world and our own internal abilities to deal with stress.
Thank you. So now we're all relaxed. Thank you for watching. We hoped it helped. Thank you, Dr. Rivinus, and we'll see you
Thank
for
you,
the
Peter.
next Tommy Rocket Show.
So slip inside this funky house. Whoa, dishes in the sink, the TV's in repair. Don't look at the floor, don't go up the stairs. I'm aching, I'm shaking, I'm breaking like humans do. I'm aching, I'm shaking, I'm breaking like humans do.
You hear people say it all the time. Someone else will do it. Someone else will donate blood. Because someone needs blood every 2 seconds. I'm happy to do it. It's just that it's a lot for one person to take on. Good night.
Good night.
Good night.